time for NuWellness TV with Dr. Lee. Join your host, the accomplished Dr. Cherilyn Lee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery.
Hello there, everyone, and it's been a while, but no one really knows that if you're just tuning in. I want to thank you. I have such special guests today that I'm so excited for the guests that I have here today. This is truly a life-changing show because you're going to hear things on this show that you have never heard before unless you know about biological dentistry or holistic dentistry. You're going to hear some things you never knew. You might be suffering from a condition and you don't know why. Today you're going to find out. And we're going to do everything we can in this time period to give you a mouthful of information as we discuss where does disease start. And also as we go through this journey, we're going to be discussing Dr. Blanche and Anita Tibau. We're going to be discussing their book. And the book is amazing, which is entitled, Chew on This, But Don't Swallow. I have some questions about the title as we go too, but not right this minute. But I want everyone to really get pen and paper and make sure you write notes. And if you have questions, you'll be able to email myself or the doctor who is my guest today, who is the dentist. But these are questions you have to have answered. You need to know what to expect going to the dentist, and not just going to a dentist, to a biological dentist. So without further ado, I just want to go ahead and introduce my guests. I have Dr. Blanche, and
Hi.
I have Anita. Tell me your name. I know your name, my dear. Thank you so much, Anita Tibau. Thank you so much for being here today. This is just a wonderful, wonderful gathering today of parting knowledge and information, because knowledge is power, as we know this. Right. And what's happened in the dental industry, even with my own health, this is why I have such great passion. And when I see patients, I make sure they follow up as much as possible with a holistic or biological dentist. So without further ado, Anita, I'm going to let you tell people a little about yourself, and then you're going to introduce the doctor for us, the good doctor. Thank you so much.
Okay. Thank you so much, Dr. Lee, for having us. We're, of course, very excited to be able to share this information with your viewing audience regarding biological dentistry and whole body health. Dr. Blanche Grube, what can I say? She has been my mentor and a dear friend, and she's now my family. She is probably the top biological dentist on the planet, in my opinion. She studied with Dr. Hal Huggins for many, many years, and together they developed the Huggins-Grube protocol, which I'm sure she'll be able to discuss in further detail later. As far as I'm concerned, as you know, I have been working on a global ban on mercury in dentistry for more than 20 years now, and I participated in the Minamata Convention on Mercury Treaty for the last 20 plus years. And even though the treaty has moved forward, we still haven't gotten a ban on mercury in dentistry. So hopefully this book is going to help us to achieve that goal.
Yes. Okay, doctor, I want you, and you've already shared the doctor, we're going to just kind of jump in and ask to get some questions moving, because
Sure.
a lot of people, I want to really kind of start off this show with you kind of telling us when a person come to your office, because some things I actually found out today on some testing that you even do at your office, which is really a wonderful, Dr. Blanche, that people should know. So when a person come to you, I know you have, people complain about my intake forms, but I heard you have a very in-depth intake form for new patients. And I want you to tell people, just like if a person was listening and they want to call you, they picked up the phone and they want to call to set an appointment. What is the starting component of this to get in to see a biological dentist, to see you? Because you're totally different. You're totally different than most holistic. And I know a lot of holistic biological dentists, but your format is totally different. And a lot of diseases will be caught early and preventing, other conditions and dementia. And, we just don't know.
Right.
What we don't know is hurting us. It's really,
Exactly.
truly hurting us. So
Exactly.
if I were to call your office, let's go through the steps and why to
Right.
get into an
Well,
appointment, okay?
if you were to call my office, the first thing my receptionist would do would be to ask you to have a blood test, a complete blood test. That means everything: white blood cells, red blood cells, chemistry, what your calcium level is, how well are your kidneys functioning. And it usually comes back from the laboratory. It's a good 5 to 6 pages of numbers that I was trained very well by Dr. Huggins on how to read and how to interpret. And when we read these tests, we interpreted them very differently than the way most of your medical doctors interpret them. So we're able to tell people way ahead of time if they were heading in a bad direction. Dr. Huggins' philosophy, and now it's my philosophy, was never that to wait until somebody was already sick, give them the diagnosis and tell them, you know what, I'm really sorry to say you've got diabetes. So, for an example, it's much better to tell somebody, you know what, you are heading towards diabetes, and now is the time to make the change. So all of my patients have a full blood chemistry. They also have a hair analysis. The hair analysis tells me two things. It tells me, number one, how good are they at dumping and detoxifying all on their own, without taking any chelating agents or any medications or things that people take to pull heavy metals and toxins out of the body. How well do they do it all on their own? The hair analysis tells us that. The other part that the hair analysis tells us is, what is their mineral level in the body? We could do a whole TV show on just minerals, because 99% of the patients that come to see me, maybe it's higher than 99%. 99% of the patients that come to see us are all deficient in minerals, and they're absolutely
That's
clueless
amazing.
about it. Yeah, 99%.
That's amazing.
So
Yeah.
that's the first two things you have to have done: a blood test and a hair analysis. And if you have fillings that need to be replaced, well, I've got to be able to figure out, after I do all of the wonderful things that I do to take your mercury fillings out as safely as possible so that you don't get another dose of mercury, after I've done all of that, how would I know what to put in your mouth?
Yes.
So we recommend the patients have a test done by Biocomp Laboratories. It's called a biocompatibility test. Patients send in their blood. It is a fasting test. You have to give a couple of vials of blood. The serum gets sent to Biocomp Laboratories, and we test their blood against about 88 different dental components. These are not 88 dental products. These are components that make up thousands of dental products. So I can give you an example. If you're allergic, or you're reactive, I should say, that's a better term, reactive to aluminum, then our test is going to show you all the dental products that have aluminum in them. And therefore, those are products that you probably would want to shy away from. So those are the three tests. You have to have a blood test, you have to have a hair analysis, you have to have a biocompatibility test.
Amazing.
Then we know where you're at. We do the complete examination, and I can tell you where you're at dentally. And then I give my patients, I like to try to give them at least 3 options if I can. I cheat a little bit, because option number 1 is always do nothing. That's
Right.
always an option. And so patients have to think about that. What if you decide to do nothing? It's a free country. You can decide to do nothing. What would the repercussions be if you do nothing? And then we move on from there. Okay, then what's the next best thing to do? If you're not going to do nothing, if you want to live a longer life, if you want to live a healthier life, that's really what I'm all about.
Yes.
I'm not a smile dentist. I'm not a smile dentist. I'm not an aesthetic dentist. I'm not an implantologist. I'm not, Anita doesn't need a smile dentist. Anita has the most perfect, gorgeous smile, and her teeth
Yes,
are just
she does.
absolutely.
I always told her.
She's like the poster child for perfect smiles.
Knowing her 19 years, yes, hasn't
Right.
changed.
But that's a God-given gift.
Yes.
It really is. It's a God-given gift.
Mhm.
And it doesn't make sense to me for somebody to try to get that perfect smile if it's going to put their health in jeopardy.
Yes.
Okay, so in dentistry, you know, from the crib to the grave, dentistry offers procedures and convinces the public that they must have these procedures, and convinces them that it's just an absolute must. And some of these procedures are not only toxic, but they're outright dangerous. Not everything that you're told in the dental office you need. I love that word.
Can you give us
The
some
dentist
examples
says
of the procedures?
you need a root canal.
I hear
That's
that one a
number
lot.
one
I was
example.
told that
You
years
hear that.
ago.
The dentist walks in and says, "Oh, I'm sorry. I looked at the x-ray. You need a root canal."
Yes.
Or the patient says, "Gee, this tooth's a little sensitive." "Oh, you need a root canal." Or worse yet, "We see a microscopic crack in your tooth." "Oh, you need a root canal."
Yes.
And it makes me crazy.
And let's tell our audience why. I know why, because I had mine years ago and had some work done. But why we should not go through and kind of walk people through and tell them as to, I want to say the danger, because it is, because I had things happen to me because of root canals. But share with our audience why. And because I want to really hit on some things, because people have called me today. Actually, 3 people today had heart attacks. They also have a history of root canals. This is today.
Right.
Phone calls. You know, people have been seeing the information that went out
Right.
for the show, and they wanted to know, well, what should I do? I wanted to have implants. Why shouldn't I have an implant? All these different questions people are asking me. And I understand also at your lab, you do another test. Does it have to do with flossing? A floss test to check the bacteria?
Yes, several of the tests that we do are very simple. They just require a piece of super floss. You know, floss is like a string. It's like a thick piece of
Right.
cord, thick piece of thread. Super floss though is fuzzy. So when you slide super floss between the teeth, you pick up a lot of the microorganisms that are in between the gums and the tooth. And so we actually can use superfloss for things like our APOE tests.
Okay. And can you
That's a
tell people a little
superfloss
bit about
test.
the APOE test?
Yeah, the APOE test is a test that determines what kind of proteins you inherited from your mother and your father that determine how well you can detoxify and how well you can get rid of mercury in the body. If you are a very good detoxifier, the chances of getting Alzheimer's in your 70s are rare. Usually you could get Alzheimer's in your late 70s or 80s. But if you wind up inheriting the bad genes from either your mother or your father, you could wind up getting Alzheimer's at a much earlier age. So we highly recommend people to do this test, find out what their APOE numbers are. And then once you get those numbers, you can make an intelligent decision.
So this is not a blood test, because I actually do some of this
No.
gene testing through blood. I just want to make that clear. This is not a blood test.
No, this is a superfloss test.
Okay.
That's it.
So the lab would send that to them, or they call you. This is what they obtain as a new
No.
patient.
They would go to DNAconnections.com,
Okay.
the website.
Okay. And that's
And so
DNAconnections.com.
superfloss test is one of the tests that we do. Superfloss is also the material that we use for patients to find out how sensitive are they to gluten.
Really? Oh, that's
Yeah,
wonderful.
so we do a gluten intolerance test with
Okay.
superfloss again. There's another test that we do. Our most popular test is our Lyme disease test.
Okay.
And that came about, interesting story, just about the period of time when Dr. Hal Huggins was getting ill and was getting ready. He knew he was going to be passing the lab over to me. And I walked into the lab one day and the lab techs were all excited. They said, Dr. Grube, did you hear the news? I said, what news? They said, we found Borrelia burgdorferi inside one of the root canal teeth that you sent us. So I had sent a root canal tooth that I had extracted from a patient. I sent it to the laboratory and they picked up Borrelia burgdorferi. Borrelia burgdorferi is the microorganism that causes Lyme disease.
My goodness.
And I was shocked. I was just as shocked as all of the other lab techs and research
Right.
scientists. I
So when
really
we say
was.
diseases start in the mouth, we have to
Yeah.
really.
So isn't that interesting? That
Hmm.
who would think you would have Lyme disease inside your mouth in a root canal tooth,
Exactly.
and yet it can be picked up in the mouth. So,
Exactly.
it was kind of funny. I'm working in a wonderful integrative clinic right now
Hmm.
in Hilton Head, South Carolina. And we not only have medical doctors, chiropractors, I'm the dentist, we have a colon hydrotherapist. And this fellow and I walk around just shaking our heads and saying, you know what? They just haven't figured it out. All disease starts here in the mouth and it ends at the other end where the colon hydrotherapist takes care
Yes.
of it. All disease
Yes.
starts
Hmm.
in one end and ends at the other.
Yes.
No kidding.
Yeah. So I want to, talk about some of the conditions as well. If we've already finished lab testing that you do at your
Right.
office and why, I want to talk about, you know, cancer in dental,
Mm.
cancer in gums. What do you see there?
Well, what we're
Not
finding
so
out
much
now,
oral cancer, not cancer of the mouth, but cancer in the body.
right,
Hmm.
cancer in the body.
Yes.
Anita, you want to take this one? Because, everybody knows that periodontal disease is related to cardiovascular disease.
Not
That's
everybody. The
not
people I spoke to
everybody. Okay,
today.
not everybody.
No.
This
But
is
then Anita started doing some research and found out some fascinating pieces of research. So, Anita, why don't you talk about that?
okay.
Thank you.
Thank you. There are so many papers that are being published pretty much daily now
Yeah.
on the link between oral health and cancer. And I'm not talking just, um, you know, well, pancreatic is one. Um, Breast cancer. There's so many associations, prostate cancer, liver cancer. All of these are being shown to be caused by oral health
And also brain
microbes.
cancer.
Yes.
Brain
Oh,
cancer.
Yes.
Big
brain
time brain
cancer, which
cancer.
is
Yeah.
that's a whole other thing because now we have cell phones, we have metal in the mouth, and we have EMFs, and we're
Exactly.
just doing some research on that now. And it's bad news. So people that have heavy metals in their mouth, either implants or mercury fillings or nickel crowns, all of these things are very, very toxic metals. They all break down, and cell phones and these EMFs and computers, they all push the levels of exposure to a higher degree all the time.
Yes.
So it's bad. But the links between cancer and oral health, it's conclusive.
Yes.
It is conclusive. The problem is nobody's talking about it.
No. And that's what I want to really kind of dive into today because I'm the only one in the world that's doing the CRT, contact thermal regulation scanning for free. And a
Oh.
part of it deals with dental. So
Hmm.
this is why I'm really big on this because now I see the scans of the teeth, but I'm also seeing, it's FDA approved for breast health or breast to see if there's any abnormalities with the breast tissue. And I
Right.
always end up picking up, which we know from talking to when meeting Dr. Huggins years ago, that it didn't matter about tooth organ relationships anymore. It's the mouth itself, it's the gums themselves. And so
Right.
it's going to play havoc. I had at least 3 patients in almost 17, 18 years I've been doing the screening with breast cancer, and they did go see someone, and as soon as they did a cavitation,
Mm-hmm.
this lady had such severe breast pain, and another person with hip pain, and as soon as they did the cavitation, the pain went away, and they
Mm-hmm.
start to heal. So we know they start to heal a lot better. So I want to get into that because I have so many people. It's almost weekly I have a new cancer patient. So I
Right.
really want to spend time letting people know the situation with cancer as related to dental. Because people are not seeing that. Cardiovascular, we definitely have to get into that because people are taking all these blood pressure medicines and doing all these other things medically when they change their diet. See what's going on with the periodontal. That periodontal disease will
Right.
kill you. It
That's
isn't
right.
the medication.
That's right.
Yeah.
That's right. Years ago, Dr. Huggins challenged a class of about 60 dentists, and I was the only woman in the class. So he would say, "You guys, I'm going to challenge you guys, okay? And he said, if any of you find a patient with cancer that does not have a root canal tooth or cavitation, he said, I will give you $1,000. And I was so excited. I just knew I was going to win this bet. I'm going to keep looking and looking and looking. Well, about 24 years goes by, still haven't found anybody. Every single patient that has come through my office that has cancer has either root canal or cavitation.
Can you explain to our listening audience exactly what is a root canal? Because people really still don't know.
Yeah, they don't know.
They think they
don't know.
had
They think
one, but they really don't
yeah.
know what they had. And then explain a cavitation, please.
With root canals, they think it's just a procedure that the dentist does to keep the tooth. When I tell people you shouldn't have a root canal, they say, yeah, but it's important for me to keep the tooth. And if I have a root canal, I can keep the tooth. What they don't understand is that once the dentist does the root canal, the main body of the tooth, what we call the main nerve of the tooth, down the middle, that is filled with toxic chemicals and a rubbery material. It's got formaldehyde, it's got phenol. If anybody is listening, they should know that formaldehyde and phenol are chemicals that keep the body from rotting away. The Egyptians used to take gauze and dip it in phenol, and they would wrap the bodies of the pharaohs, and it would make the body shrink, but it wouldn't rot away. And when they opened up the tombs, they would see the pharaoh's bodies still there. That's what phenol and formaldehyde
And that's
does.
what they're putting in your mouth. Oh my goodness.
That's what they put
in your mouth.
Exactly. So they clean out the main canal, put some formaldehyde and phenol in it, but they do nothing, absolutely nothing, to the millions and millions of lateral canals. So when I tell people a tooth is like a tree, you've got the main trunk of the tree, but then you've got the main branches, and then the minor branches, and then you've got the leaves, and then you've got, it goes on and on and on. And if you were to take every dental tubule, every little tube that you have in your tooth, and put it in a straight line, it'd be about 3 miles long. And so the dentist cleans out the main trunk of the tree. The dentist does nothing to all the branches. And what happens with time is that the microorganisms that are inside that main trunk of the tree start to move laterally, and they start to eat up the protein, and they begin to absorb carbohydrates and fats from your diet. So they get to eat what you eat. They eat everything that you eat, and then they do the same thing you do. They piss and poop after they're finished eating. That piss and poop, we give it a fancy word in medicine. We call it toxins. It's nothing more than bacteria piss and poop.
I'm glad you said the toxic. People know about toxins, so I'm glad you related it to the toxins.
But toxins is bacteria. It's not the yeast that bothers you. It's the yeast piss and poop that makes you sick. It's not the bacteria that bother you. It's the bacteria piss and poop that make you sick. So the same thing with root canals. The piss and poop that comes out of the bugs inside of a root canal tooth is what makes you sick. And so the root canal tooth usually has to be done many, many years ago to make you really sick. A fresh root canal doesn't usually make you as sick as an old root canal. The longer the root canal is there, the more toxic it is, or the more piss and poop inside that tooth that is seeping out and making you sick. Now, cavitation is a little bit different, but in many ways, a lot the same. When a dentist takes out a tooth, most cavitations are due to extraction. When a dentist takes out a tooth, if the dentist uses a chemical called epinephrine, it is naturally produced by our bodies. Our adrenal glands produce epinephrine when we think we've seen a lion and we've got to run as fast as we can up a tree. Epinephrine is produced. It's a natural substance produced by our adrenal glands. But it's also synthetically made and put inside the Novocaine that the dentist gives you. So why do they do that? Well, they do that because they want the patient to stay numb for a long time. So they don't have to stop and constantly be giving them more and more Novocaine. The other thing is it causes vasoconstriction, which means it causes the blood vessels to shrink. And so then that keeps the patient from bleeding a lot. So dentists love epinephrine. It keeps you numb for a long time, and it keeps you from bleeding a lot. That's, as far as the dentist is concerned, that's a great thing. As far as we're concerned, it's a bad thing, because when those blood vessels contract, the smallest of the blood vessels, which are the capillaries, they close completely. And now there are poor little white bone cells, white bone cells sitting there waiting for oxygen, and they never get the oxygen because the capillary that was going to send them red blood cells with oxygen is completely closed. So it's very interesting. The dentist takes out the tooth, sticks in a piece of cotton, sends the patient home to recover, and expects the bone cells to reproduce and make new bone cells. But dead bone cells don't reproduce. Dead bone cells don't do anything. They just sit there.
Right.
So when a dentist takes out a tooth with epinephrine, the top of the socket heals up because the tissue is real soft up there and there's lots of blood up there. But the bottom, the inside of it, doesn't heal up. It just sits there and it becomes a cesspool. And so this is where cavitations are very similar to root canals. The longer the cavitation, the longer that tooth was extracted years ago, the more toxins, bacterial, piss, and poop, are in that hole. And the more toxins in that hole, you finally get to the point where it starts to seep out of the hole and the body becomes aware of the fact that, oh boy, we got a problem over here. And that's called a cavitation. And the only way a cavitation can get fixed is to surgically go in and rotor the hole again without epinephrine and allow it to heal normally. And the only way a root canal can be fixed is to take a pair of forceps to it and put it in the garbage can.
Okay. So when people say
that's sad news. People don't want to hear that.
No, I know. And because when they do a root canal, they didn't actually go in and remove the entire root, correct?
No.
And that's what a lot of people say.
They're just taking the soft pulp from the middle of the tooth.
Yeah.
That's it.
Because a lot of people have told me, no, he took the whole root. I say he did not.
No. That's called an extraction.
Mm-hmm.
If they take the root out, that's called an extraction.
Right.
Then the whole tooth is out. Okay? Now, if you had diabetes and suddenly one day you look down at your toe and you see that it's black, maybe you got carried away and you kicked the door or you kicked the dog or something happened, your toe got hurt, and one day you look down and you see your toe is black. If you go to a physician, you've got diabetes, that doctor is going to immediately say to you, I'm very sorry, your toe is necrotic. That's the fancy word for dead.
Right.
Your toe is necrotic. We're going to have to cut your toe off. There's no medical specialty that keeps a dead part of the body in the body except dentistry.
Say that one more time. Say that again, because that's pretty good.
There is no medical professional, not a one. There's not a specialty. There's no medical professional that will keep a dead part of the body in the body. They don't do that. If something is necrotic, that's a fancy word for dead, it must be removed because all of medicine knows that necrosis is a terrible, terrible thing, that the bacteria and the toxins that come from necrotic tissue will kill you. Yes. Everybody seems to know that except the dentist. I don't get it.
And then later on, people become ill and they don't know why they're sick.
They don't know why they're sick.
And because when I asked them, even the people that call me today, 3 people, a family of 3.
Oh, Lord.
The father, the son, when they asked me this question, when I asked them, because the father had a heart attack, the son is impending a heart attack, and I'm asking, and this is every day almost, wow. Did you ever have a root canal? And they say yes.
Yeah, sure. Yeah, what's in your mouth? Anita's great at that. I mean, she'll be going into an elevator with somebody, and if they complain that the least medical problem that they have, Anita will immediately say to them, what's in your mouth? And look at her. Really? Right, Anita? She goes, what's in your mouth?
What's in your mouth?
Because one of the things that are very common with everybody are mercury fillings, mm-hmm. Which according to a recent study, half of the U.S. population, because they actually counted the fillings, has mercury in their teeth, and the average amount of fillings is 5. And we now know definitively that mercury does cause Alzheimer's disease. It's not illumin, it is Alzheimer's.
Yes.
And most people also have had their wisdom teeth taken out. And I think, Dr. Blanche, that's one of the things too that you see often. People say, well, I don't have mercury in my mouth. and they're still not healthy. But the big one, the unknown, is also this whole thing about cavitations. And I can tell you, just from my own experience, talking to people everywhere, they're like, oh, I had my wisdom teeth out and I'm okay. But then they're not okay.
Right.
And what happens when you go into these old extraction sites for wisdom teeth?
What
The
happens?
smell is horrendous. You drill a small little hole and the gases come out and we all want to pass out.
Oh,
The
my
smell
goodness.
is horrendous. And isn't it interesting that if you look at the Chinese meridians and you take a look at every meridian in the body, for those listeners who don't know what Chinese meridians are, those are the parts of the body that the doctors of Oriental medicine will work on when they do acupuncture. They
Okay.
go into the meridians and they decide which meridians need to be stimulated and which ones need to have energy taken away from them. When you look at these meridian charts, every meridian goes through a tooth.
Yes.
And isn't it interesting that we have generations, not just one generation, but generations of people who have had their wisdom teeth removed somewhere between the ages of 17 and 22, 23 years old.
Yes.
We have generations of people who have had their wisdom teeth removed, and then later on in their 60s, they're having heart problems. Well, guess what? The heart meridian goes through the wisdom tooth site.
Hmm.
They are connected. So when you have a cavitation, or worse, a dead tooth in the heart meridian, it means that the heart is constantly sending energy up through that area, but the area does not give the heart back the same amount of energy that it's due.
Amazing. Yes.
So it weakens the heart.
Mhm.
If it's your first molar, that's the large intestine meridian. Same scenario. The energy flow comes from the large intestine, goes up to the first molar, swings around, and expects that first molar to give back energy to the large intestines. And if it doesn't, then the patient's got colon cancer cooking. Then they've got colitis cooking. Then they've got Crohn's disease cooking. Then they've got all kinds of things. And it's coming from a root canal tooth in the large intestine meridian.
I have a question because of, years ago, I attended cancer control, which Anita and I always were there for many, many years. And one of the things that, and Dr. Huggins had in this lecture he was given, and was all these organisms that were found in the mouth. And
Right.
this bacteria that's found in the mouth. And he said you didn't really find it anywhere else. I have a question because seemingly SIBO, what have you been seeing with SIBO, small intestine bacterial overgrowth? Because it's, the small intestines that they say they don't seem to find the same organisms in the colon.
Right. That is true.
So-
in SIBO, you have an overgrowth
Yes.
of bad bacteria in the small intestines.
In the small intestines. Is this coming also from the mouth?
Well, that's the
Yeah,
second.
that's the second.
molar. The second molar goes
Second
to
molar.
the small intestines.
Small intestines.
Yeah, we got a tooth
Because
for
I
every organ.
I told some people this. I said this problem is really linked to
Yes.
SIBO is linked to your teeth and your gums and all this
Absolutely.
bacteria.
Dr. Blanche did a lecture on that, about 2 years ago, before COVID.
Yeah, way before COVID, I gave a lecture at the SIBO conference.
Oh,
and,
okay.
and discuss with them, the problems, and they really, they pay a lot of attention to the small intestines, but you got to look at the mouth.
Yes.
That
If
is
you're not looking at the
missing.
mouth, you're
You,
missing.
you're going to take
the
all
boat.
this medication, and a lot of the
Yeah,
hospitals
you're
now have
missing the boat.
SIBO clinics, and they're giving all these
Yeah.
antibiotics on top of that.
Right.
Let's talk about
I heard somebody make a statement this year that how you hear the same things over and over again and it doesn't hit you until somebody says it just a little bit differently.
hmm
This year I heard somebody say, it's not that you are what you eat, because I've always heard you are what you eat, right?
Yes.
Everybody's heard that you are what you
Yes.
eat. No, correct English would be you are what you ate. And you
Yeah.
think about that.
Yeah.
The physical body that you have right now
Mhm.
is a result of all of the food you ate up to this point.
Exactly. Very
And
good.
when it
I
comes
like
to
that.
SIBO, when it comes to everything, yes, the teeth are important. The mouth, the microorganisms have to be controlled in the mouth. But how does that happen? It's by what you eat.
Yes.
If you're going to eat a ton of sugar and white flour and Coca-Cola and I don't want to say the name of the restaurant. That's the one that everybody goes to every day for lunch. If you're going to do all of that, you're fighting an uphill battle trying to get the right bugs in your mouth and in your from the mouth to the esophagus to the stomach to the small intestines. You're going to have, it's an uphill battle if you're going to eat crap.
Right.
It's
And
that simple. Yeah.
there was a situation where I don't know if I read this. People who have the mercury fillings, doesn't it expand in the mouth and then it breaks?
Well, the mercury fillings themselves expand.
Yes.
They absorb saliva and they expand, especially if the dentist put the filling in the mouth a little bit on the careless side and the tooth wasn't completely dry, then the zinc that's inside the mercury filling causes the tooth to expand even further. And then it causes the tooth to crack. As opposed to composite fillings. Composite fillings do just the opposite. They suck the tooth in. So very often a dentist sees a crack, they'll say to the patient, you need to have a crown here. No, they're much better off getting a composite filling that's going to bond all of the walls of the tooth and suck it in. Of course, a composite filling that's done properly.
A composite filling, and what would that be? So after you do the compatibility?
After you've removed all of the mercury, you remove the decay, then you build the tooth up with composite depending on what composite the patient's okay with.
Yes.
Do you know how many composites? There's got to be 2,000-3,000 different kinds of composite out there. Some of them are excellent, and some of them I wouldn't put on a dog.
Yeah, I've had a lot of people tell me I had the filling done. Now, for those who have bone loss, you shouldn't probably use a cadabra. I mean, you can go. I want you to hit on that just a little bit. We're running out of time a little bit, but if you can share a little information on when people have bone loss. I had a procedure done called a PRP, protein-rich plasma. I've had it done before, but I want you to expound on this a little bit. People who have bone loss and they tell them, well, you need a bone graft there. So those are the people too who are trying to get implants.
I don't know if I can do this in 2 minutes, but I'll try.
Okay.
And this is something that Hal Huggins would say over and over again. Anything you put in the body that is not self will be recognized as not self. And then the body will spend 24 hours a day, 7 days a week trying to get rid of not self. There is no such thing as sterile cadaver bone. We proved that in the laboratory. There is I don't care who made it, how they sterilized it, no such thing as sterile cadaver bone. And there's no such thing as any kind of cadaver bone or artificial bone that will not be recognized by the body as non-self. Now, the procedure you had done, plasma-rich protein and plasma-rich fibrinogen, that came from your own arm.
Yes.
That came from your own blood.
Yes.
So that's a totally different story. Your body said, we know this. We know where this came from. This is Cheryl. No problem. Look at it. It's got her name. It's got her initials.
Right.
Everything is good. That's very, very different than putting in artificial bone, cadaver bone, hydroxyapatite crystals, all these different things that they stick inside people's bone marrow. The bone marrow is actually part of the circulatory system. It's where your white blood cells and red blood cells are born.
Yes.
It's not part of the skeletal system. No, the outside bone is the skeletal system.
Yes.
The inside, the bone marrow, is part of your immune system. It's your circulatory system. And it has to be treated with respect.
Yes,
and that's one of the reasons why I'm not a lover of implants either.
Yeah, and I have people calling me now.
Yeah, 2/3 of the implant is in the bone marrow. 1/3 of the implant is in the mouth, which happens to be the dirtiest part of the whole physical body. You have more microorganisms in your mouth than you do in your anus.
Yeah, I've told people that. Yeah. Exactly.
And so,
and they don't get it.
How do you maintain the integrity of the collar, the part where the mouth part of the implant ends and the root part begins? That we call that the collar. How do you maintain the integrity of that? Because if it opens up 1 cell thick, that's all you need. If it opens up 1 cell thick, you've got millions of microorganisms traveling directly into the circulatory system.
Yes.
Yeah, so implants are a problem.
Yes. So
Anita's doing some wonderful research now, finding out, everybody, when they first started coming out with implants, and now I'm really aging myself, early 1970s, they used to tell the patients they're only going to last 5 to 10 years. Well, that's because they did. They fell out after 5 to 10 years. The body got rid of them.
Oh my.
Then they discovered, we can put bone graft around it. It'll last longer. That's right. It's much harder for the bacteria in bone graft to get pushed out of the body. It's much more difficult. So they last longer. It doesn't mean that your immune system's not working against it every day.
Right.
It's
exactly.
Just, it is lasting longer. So now the new thing in dentistry now is everybody's doing zirconia or crystal implants.
Okay.
They're supposed to be the best thing since white bread. Okay.
Yeah.
And Anita's now finding out, hey, guess what? Maybe they're not so great.
Right. We're going to be wrapping up really quickly.
Okay.
In the last closing, which is we're about to close, what would you like to leave our audience in less than 10 seconds? I'm sorry.
Yeah, in less than 10 seconds, I'd just like to say beware. Get a second, third, fourth opinion.
Yes.
Read. Mm-hmm. Don't just listen to your dentist and just automatically do what the dentist tells you to do.
Thank you.
Get the book.
And then, buy the book.
Yes.
Chew on
And
this.
what your title of your book is chew on this, but don't swallow that.
Yes. In other words, think about what the dentist is telling you, but don't swallow it all.
Oh, there we go. That makes sense.
Yeah.
Thank you.
Chew on it. Think about it.
Chew
but
on
don't
it.
swallow. Not until you're convinced.
Wonderful.
It's the right thing to do. And the reason I put an apple here is because everybody thinks apples are good for everybody. I'm allergic to apples.
Okay.
So apples are good for everybody except me.
Very good.
Okay.
Okay.
Just like dentistry.
We're going to be doing a part 2. I want to thank everyone for tuning in.
Cool.
Thank you so much, Dr. Blanche. We definitely, because we want to get some histories of some of the people who have been treated and what they had going on with them prior to meeting a biological dentist like yourself. You have saved so many lives, and I'm so happy.
Lots.
So, Anita, thank you so much. Dr. Blanche, thank you. Yeah. I am so honored that you took the time to be a guest today. And if anyone have any questions, please, you can contact Dr. Blanche. You want to give your number up just very quickly? We're closing.
Yes, 570-343-1500.
Okay.
570-343-1500.
Wonderful. And Anita, you do a lot of research. I don't know if you want them to call you.
Anybody can call me, 310-923-4116. This is what we live for, helping everybody.
Thank you. Well, this is part 1 of a series, because we have we have more work to do. So I want to thank you both. I want to thank everyone for taking the time out of their busy schedule to tune in NuWellness TV with your host. Thank you very much. Have a blessed day.
Thank you, Dr. Lee.
Thank you very much.
Thank you.
Bye-bye.
Bye-bye.
Bye-bye.